Dear colleagues, ladies and gentlemen, welcome to the view from the Thoraxcenter for Radcliffe Cardiology. My name is Nicolas from Mieghem. Next to me, my good friend and colleague Joost Daemen. And as always, we will preview and wrap up the big meetings, the big cardiology meetings in terms of late-breaking trials. Today, we're going to preview interesting late-breaking trials of AHA 2022. And Joost, there is new data coming from ISCHEMIA trial.
Yeah, so ISCHEMIA, as you recall, was the blockbuster trial that randomized over 5,000 patients with stable ischemic heart disease and proven myocardial ischemia to either optimal pharmaceutical therapy versus an early invasive strategy plus optimal guideline-directed medical therapy. And the trial actually was negative at a median of 3.2 years, no significant difference in the primary endpoint, as you recall. However, there were some peculiar findings like an expected increase in per-procedural MI in the invasive arm. However, a crossing of the event curves in the median course of the trial in favor of the invasive strategy arm, and a late increase in non-cardiovascular deaths in the also in the invasive arm. And with that, the investigators fortunately decided to extend the follow-up of this important trial up to 10 years, and that is what the investigators Judith Hochman will present now at the AHA. So something at least I look out for if the trend towards a reduced risk of late MIs in patients that received early invasive strategy truly remains, which is somewhat what I believe. I think that would be good news. The excess of non-cardiovascular death in either arm is something I could not explain. So yeah, this to me will be an interesting one.
It is interesting, but we do have to bear in mind the limitations of ischemia.
Absolutely.
Yeah, I think nowadays the field is evolving in more, I think, shared decision making, and you can treat a patient with chronic coronary syndromes conservatively with medical therapy, and then you can be more invasive, and I think the outcomes of both strategies are quite good. There's not only ischemia, we also have other big randomized controlled trials now. So, but it's good to have long-term follow-up. I think this is very important.
Yeah, absolutely. And what is something I don't know yet, but something I look out for is the fact whether I not know whether they will present data on quality of life, also in the longer run.
Yeah.
But that is something to look out for. A lot of focus in this year's AHA, as usual, on AFib and heart failure, and we highlighted several trials on within the heart failure space.
Yeah. So first, zooming in on acute heart failure, there is a randomized controlled trial which is called the ECMO-CS trial. It's a trial stemming from the Czech Republic, 114 patients, and the randomization took a little bit long between 2014 and 2022, so 8 years of enrollment. But at that time, 114 patients with cardiogenic shock were enrolled. And then the question is, what kind of cardiogenic shock? Are we talking about ischemic and non-ischemic? That's not clear to me at this point. And the primary endpoint is a composite of all-cause mortality, need for additional mechanical circulatory support, and it's interesting that they also defined criteria for the conservative arm, for the control arm basically, when mechanical support was allowed per study protocol. So they will, it is an interesting study, but there are some unknowns. Again, ischemic versus non-ischemic, and also what kind of shock patients are we talking about? Are we talking about shock stage B, stage C, or stage D? And I think that will definitely play a role. And I would also be interested in whether the ECMO arm has some penalties in terms of access site and bleeding complications, because that's always something to bear in mind. At the same time, this is a relatively small trial that is preceding a larger trial by Holger Thiele, which is called the ECLS shock trial, that specifically focuses on patients with an acute myocardial infarction complicated by cardiogenic shock, and then randomizing those patients to ECMO versus standard of care. So I think this will be a prelude to a larger study, but definitely interesting findings to be anticipated.
Yeah, absolutely. It's also something I look out for, but with the fact that the bailout is in both arms, so for instance, balloon pump in a cardiogenic shock patient with an ECMO or an Impella, including bailout in patients that are really deteriorating in the control group will make me wonder with this whether this trial will meet a 50% reduction in its primary endpoint.
Well, and I think that's a good comment. So the question is intra-aortic balloon pump a mechanical circulatory support device that is counted for?
Good question. I don't know.
Obviously, we all are familiar with ECMOs, and from time to time, and basically this is our standard of care, that we immediately insert a balloon pump to vent the ventricle in the context of cardiogenic shock. So we'll see how the trial evolves, and definitely something interesting to follow. Then there is the Transform HF. Transform HF basically is a concept trial. It will enroll 6,000 patients to compare Torsemide with Furosemide, so two diuretic, diuretics, loop diuretics, if you will, and they promote themselves as a practical, pragmatic trial. So the aim is to enroll many patients to basically provide an incentive to patients to participate in the study, but also to make study follow-up and monitoring easier for the participating sites. So let's see whether they were successful. I think the main objective of the study is to demonstrate fast study enrollment, but still at a high quality level. Whether Torsemide and Furosemide would be different, I think, in my opinion, that will be more of a detail of this study.
Yep, I agree.
Okay, and then the third study in the heart failure context is the IRONMAN study. The IRONMAN study is a UK-based trial. 72 sites enrolled 1,160 patients with heart failure. Patients were admitted with heart failure or were ambulatory but had elevated NT-proBNPs. And all patients were proven to be iron deficient, and I think that is important. Yeah. Then patients were randomized to either IV iron therapy or placebo, and the primary endpoint was a composite of all-cause death, all-cause mortality, and heart failure hospitalizations, and then the secondary endpoints, the typical heart failure admissions, quality of life, and so on. Minimum follow-up was 3 months. I expect a positive study because obviously you not only take heart failure patients, but you also have proven iron deficiency. So I would be very surprised if this would end up being a negative study unless the trial is underpowered. That's possible. That said, I think this kind of studies really highlight or create awareness for the issue of iron deficiency in cardiovascular disease. We also see this in our patients with valvular heart disease, also in patients with advanced coronary disease. So I think it makes a lot of sense to create some sensibility for iron deficiency. Yep.
Yeah, this is for sure a hot topic that has been studied in multiple patient categories with multiple comorbidities. In this trial, I think the likelihood that this trial will end up positive will be in the recruitment period of the trial. So the minimum follow-up was 3 months. And with an endpoint being mortality, I don't think it's very likely that depleting iron will result in a mortality benefit in only a couple of months. So this is something that will likely turn out in a benefit over longer course of time. But yeah, we'll see.
We'll see what the median follow-up is. Huh?
Yeah.
Yeah.
Hyperlipidemia.
Yeah, in hyperlipidemia, I'm happy to announce that there is yet another trial on omega-3 fatty acids. And this time it's a trial from Japan. We already had reduced it at the latest ESC meeting presented by Deepak Bhatt. Now we have the RESPECT-EPA. And this is another trial with Eicosapentaenoic acid, randomizing 3,000 patients with chronic coronary syndromes. What I say? Almost 4,000 patients, and then randomizing those patients to either a statin or statin plus EPA therapy. Primary endpoint is the first occurrence of one of the major cardiovascular events, cardiovascular death, non-fatal MI, stroke, and also unstable angina. Well, I think if this study also becomes positive, then there is mounting evidence to at least consider omega-3 fatty acids in patients with chronic coronary disease.
Absolutely, nothing to add to that.
And then obviously we need to talk about hypertension, and I hope there is also some renal denervation.
Yeah, so as you guys by now are used from us, is that there's always, we try to end with renal denervation, as this is one of our key areas of research here in Thoraxcenter as well. But before going into the RDN space, I wanted to focus on 2 trials on novel drugs for hypertension. This is not like the hyperlipidemia field in the past 10 years. The number of new blood pressure lowering agents has been limited. But there are 2 drugs that will now be released with more detailed data here at AHA. One is Precision. It's a trial that will be presented by our friend Marcus Schleich, who ran the Precision trial, which is a phase 3 trial on aprocitentan, which is a novel blood pressure lowering agent that will be tested in a randomized controlled double-blind fashion, in which patients will be randomized to either 12.5 or 25 milligrams of the drug versus placebo, with a primary endpoint at week 4 in office systolic blood pressure. Interesting part is that patients will also be followed up to week 40 in order to determine the durability of the treatment. That is something we've learned from the RDN space that is important, but also depends on changes in drug therapy in the meantime.
Are we talking about antihypertensive naive patients?
No, so this is an important comment. So this trial will randomize 720 patients who are on a stable antihypertensive regimen of at least 3 drugs, but still, yet have a office systolic blood pressure above 140. So those are the patients that are called resistant hypertensive.
Okay. Yeah.
And that's also the reason I'm mentioning this trial, because the beef of the meeting for RDN will come at the end, and that's also a trial in patients with resistant hypertension.
We'll see what compliance also is of these drugs.
Absolutely.
Because you add another drug.
Yep. So Brighton is the second one, will be presented by Mason Freeman. It's a trial on Baxdrostat, which is a phase 2 trial, which will randomize patients to multiple doses of the drug versus placebo in the exact same patient category. So patients resistant hypertensive, office systolic blood pressure above 140, in this case with the primary endpoint, if I'm correct, at week 12. So 2 novel drugs that may be a interesting alternative to the current armamentarium of treatment options for these patients, and an armamentarium actually that is limited as far as we've learned. So for the first trial for aprocitentan, there has already been a press release from the company in May this year announcing that the trial was positive, but I think we need to look out for all the details in the study, compliance data, changes in drug therapy over the course of the study, etc. So an interesting one. But then finally at AHA this year, the final result of the Medtronic pivotal RDN trial, Spiral HTN-ON. So you may think this is a trial that I've heard about before. Yes, that's correct. David Kanzari, who will present the data, also already published in Lancet 2018 the results of the pilot trial. So the first 80 patients in the trial were already analyzed in a predefined interim analysis in this trial with a Bayesian design. And in that interim analysis, the renal denervation therapy proved to significantly lower mean 24-hour blood pressure with 6.8 millimeters of mercury as compared to sham in patients with difficult to treat hypertension on 1, 2, or 3 antihypertensive drugs. So the trial really took several years to complete enrollment. But now finally, 5 years later, the investigators managed to complete this trial, which obviously suffered from difficulties in enrollment during the COVID era. But this trial will be important for the field. It will follow the RADIANT Solo and Trio trials, and now recently the RADIANT 2 study that was recently presented. All demonstrated very consistent blood pressure and lowering effects of RDN. This trial is a little bit different in the sense that there is somewhat more liberal policy in underlying drug therapy. So there's no standardized triple therapy. There is no off-med arm. These are patients that are on a stable antihypertensive treatment of 1, 2, 3, or even more drugs during a pre-specified period pre-randomization. So as we know, all these different drug recipes in the patients may result in a certain level of bias. So I'm not sure this trial for sure will be positive, but I truly hope so. It will be tremendously important for the field, and if not, it will yield important data. It's a sample of almost 300 patients, which is 2 to 3 times larger, for instance, than RADIANT Trio. So with that, the confidence intervals can be somewhat larger. And I hope for a positive trial, but let's see.
Again, these patients are therapy resistant.
therapy resistant,
Okay, and
if
the
you want to
follow-up?
call them like that. So the follow-up is 6 months.
Only 6 months.
Yeah.
Okay. So interesting stuff, and also nicely following these other 2 drug trials in the context of therapy-resistant hypertension.
Absolutely.
Okay, with that, I think enough to look forward to at AHA, and we'll be back for a wrap-up of the results in another week. So thank you very much for joining us, and we'll see you.
Thank you for watching. Bye-bye.
Bye.